Hi, Mr. Smith. My name is Jack. I'm going to be your nurse today. Before we start, can I just check your ID band, please? So just give me a thumbs up or thumbs down if this information is correct. So your name is John Smith, and you were born January 1st, 1950. Is that correct? Okay, very good. And do you have any allergies? No? Not to chlorhexidine, alcohol, tape? No? Okay. I'm just going to sit you up to a 45-degree angle. So I'm going to be doing some trach care today. Have you had trach care done in the past? Yeah? Have you had any problems with it before? No? Are you in any pain now? No? Okay, good. So what I'm going to be doing today is we're going to see if you need any suctioning. I'm going to change your inner cannula, do some trach cleaning, and change the neck ties. So do you have any questions for me before we begin? No? Okay. So I'm just going to check first that all of our emergency equipment is good to go and available. So we have the ambu bag at 15 liters per minute of 100% oxygen. The suction catheter is set to continuous and between 100 and 120. We have a face mask for the ambu bag in case we need to give you breaths through your mouth instead of the trach. And I also have 2 trachs, one the same size and one a size smaller. All right, so first I'm just going to set up my workstation. So I'm going to do hand hygiene and put on clean gloves. And I'm going to wipe down my table, get it nice and clean. Okay, put that in the trash. And do hand hygiene. So I'm going to let that air dry for 2 minutes. And while we're waiting for it to dry, I'm just going to take a listen to your lung sounds to see if you have any secretions that need to be suctioned. So when I say okay, just take a deep breath for me. Okay. 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 All right. So I do hear some secretions in there, so I'm going to suction those out. And before we do that suctioning, I'm just going to put this towel over you so we don't get you dirty with secretions. Okay, so we'll say it's been 2 minutes and the table has air dried. So I can now put all my equipment up on the table. So I have my trach kit, my clean gloves, extra sterile gloves, normal saline bottle, new inner cannula, and my suction catheter. Okay, so I'm just going to do hand hygiene and put clean gloves on, and I'm going to change the suction catheter out for a new one because I don't know if that one's dirty or not. So I'll take this old suction catheter off, throw it in the trash, take my new suction catheter and attach it and make sure it's set to continuous between 100 and 120. All right, and I can take these off, do hand hygiene, and put a new pair of clean gloves on. So before we suction, I'm going to give you a few breaths with the ambu bag to get your O2 sat up before we suction. Right now it's at 94%, so these breaths will help get it up to 100%. Okay, so I'll take off your oxygen. With my left hand, hold the faceplate down. Attach the ambi bag. I'm going to give 3 breaths, 6 to 8 seconds apart. So 1, 2, 3. All right, so looks like your O2 sat is up to 100%, so that's good. Okay, so now we're ready to suction. So before I do that, I'll just close the curtain, give us some privacy, and get my suction catheter. And actually, before I do that, I'm going to pour normal saline into my little box container. Okay, and then take my suction catheter. I'm just gonna pull the tip out 3 to 4 inches, and I'm gonna dip it in my normal saline to moisten the tip and check the suction is working, and it is. I saw it go up the tubing. And so I'm just gonna insert and stop once I feel resistance or Mr. Smith starts coughing. So I'll insert and I feel resistance, so I'll stop and I'll twist as I pull the catheter out, and it goes back into the outer wrapping. So how's that, Mr. Smith? Does it feel like I got all those secretions out? Do you need another pass? No? Okay, good. So if you did need another pass, I just have to wait at least 30 seconds in between passes. Okay. So I'll hang this back up. And put your oxygen back on. All right, so that's the suctioning done. Do your hand hygiene. So next I'm going to be doing some trach care. So I can open up my, I'll move this, open up my trach kit. I can take out the dressing, take out my sterile gloves, and so I can do hand hygiene. Actually, first I'm going to pour normal saline into the compartment in the trach kit. Do hand hygiene. And drop in my inner cannula into my trach kit. Okay. Throw that in the trash. Hand hygiene. And now I'm going to put my sterile gloves on. Okay, so I'll keep my hands above my waist and nice and tight to my body. And so I'm going to change the inner cannula. So with my left hand, take the oxygen off, and then with my left hand holding the faceplate down, grab it with my right hand, pull it out, drop it in the trash. Then just grabbing the tip of the new inner cannula, hold down the faceplate again and insert that. All right, and I'm just gonna put the oxygen back on, let you get your O2 sat up for a few seconds. Okay, good. So now I can do some trach cleaning. So I'm going to take off your oxygen. I'm going to take off the old split gauze dressing. Okay, throw that away. Now that that's off, I can do an assessment of the site. So I'm looking for any signs of infection, redness, swelling, bleeding, skin breakdown, but it all looks good in there. So that's good. And now I am going to do some cleaning. So I'll take my Q-tip, dip it in the normal saline, and I'm going to clean underneath the faceplate, both sides. Okay, throw that away. Take another Q-tip, dip it, clean on the outside as well. Getting all these dried secretions off. Okay, and I'll take a gauze, dip that in the saline as well. And I'm gonna, again, clean the outside, getting these big secretions off, holding down the faceplate, making sure it doesn't come loose. All right, throw that away. And then I'll take another gauze, dry gauze, and I'll just pat dry the outside. Okay. And then last thing, I'm going to put on the new split gauze underneath the faceplate. Alrighty. So I'll just put your oxygen back on. Doing okay, Mr. Smith? Alright, good. So take these off. Do hand hygiene. So next I'm going to change your neckties. And for that I'm going to have my second nurse here, Melissa. She's going to help me. We need 2 people for this process. So put on my clean gloves. Okay, so while I untie my side, Melissa is going to be holding down the faceplate. Make sure it doesn't come dislodged. So I'll untie my side, take it off, thread it through to Melissa's side. And so now that the necktie is off, I can assess the skin where the trach tie was. So I don't see any signs of skin breakdown, no redness, swelling, bleeding, or anything like that. So that's a good sign. So I'll take my new trach tie. Thread it through. And then I'll thread it through the tie through to the other side so Melissa can grab it. Okay, so now I'm going to be holding down the faceplate while Melissa changes her side. So I'm holding it down and Melissa's untying her side. Okay, so we can throw this old trach tie away. And now Melissa will assess her side of the neck for any signs of skin breakdown or there's no swelling, redness, or anything like that. So that's a good sign, no infection. So now she can tie her side of the trach tie. All right, so now we just want to make sure that we can fit 2 fingers between the skin and the neckties so that it's tight enough but not too tight where it's constricting, and so it's tight enough that the trach collar doesn't come loose. So now I can just put your oxygen back on. So how was that, Mr. Smith? Doing okay? No pain? Any questions or concerns for me? No? Okay. Well, that's good. Thank you for letting me help you. I'm just going to put your bed down in the lowest position. And here's the call bell. Just press that if you need anything. I can take this towel off now. We're done with changing everything. So I'm just going to change the suction catheter. So I'll take this old one off, throw it in the trash, take a new one, attach that, and I'm just going to double check all my emergency equipment. So I have the ambu bag connected to 15 liters per minute of 100% oxygen. The new suction catheter is set to continuous between 100 and 120. We have a face mask for the ambu bag in case we need to give you breath through your mouth instead of your trach. And we have 2 extra trachs, one the same size and one a size smaller. Okay, so I'll take these gloves off, do hand hygiene, and I'll clean up my trash a bit. Throw that in the trash. And then I'm going to document my the date and time, my assessment of the sites, the patient's tolerance to the procedure, the color consistency and amount of sputum, Mr. Smith's vital signs and O2 set, and my respiratory assessment.